Good morning, everyone. Could you please take your seats? We'd like to begin. Good morning, honorable ministers, distinguished panelists, distinguished guests. Welcome. My name is Elisha Giangiorgio. I'm the president and CEO of the NGO Global Health Council, and I will be your moderator for today's event. Thank you so much for hosting and for joining this important session, whether you are joining us in person or online, as we are streaming. Today, we are going to talk about investing in health system strengthening for universal health coverage through a primary healthcare-oriented approach. We are at a critical juncture in the need to accelerate UHC, and as we look to the 2023 high-level meeting, it's a really important time for us to take stock of where we are on the commitments made in the 2019 political declaration on UHC, to evaluate gaps and challenges, especially those that have arisen since COVID-19, and importantly, to share best practices and lessons learned to advance UHC. Today, you will hear from our esteemed speakers about the importance of accelerating this agenda and identifying a shared vision of health for all. I'd like to open the session with our co-hosting ministers. We have with us today the Honorable Mr. Don Pramudwina, from Deputy Minister, Prime Minister and Minister of Foreign Affairs of Thailand, the Honorable Mr. Hayashi Yoshimasa, Minister of Foreign Affairs of Japan, the Honorable Mr. Zurab Azarashvili, Minister of Internally Displaced Persons from the Occupied Territories, Labor, Health, and Social Affairs of Georgia, and of course, a man who needs no introduction, Dr. Tedros, Director General of the World Health Organization. Minister Pramudwina, I would like to start with you. If you could please offer your opening remarks. Thank you.
Thank you. I'm shaking my microphone, just like you did. Certainly, welcome to the Chancellery of Thailand here. Very, very glad that we had the occasion to welcome all of you, ministers and all colleagues, to this third annual minister meeting of the group of friends of UHC and the global health. Obviously, our sincere appreciation goes to our co-chair, Georgian, Japanese foreign ministers, and certainly the group of friends, WHO, UHC 2030, and IFRC and the UN Foundation. And we certainly would like to thank all distinguished panelists for being here as well today. Can I go on with the whole lot, and then everything would be shared equally? The objective of this meeting is certainly, in our eyes, twofold: to take stock of the progress made to date towards realizing the social protection for all under the UNSG, our common agenda, and to find ways to make UHC more available as well as capable of coping with new global health challenges, such as aging population and emerging disease. As our colleagues from the WHO would attest, at present, more than half of the world's population still do not have access to the health care they all need. Every year, more than 100 million people worldwide are driven into poverty because of the out-of-pocket health spending. And at the same time, countries with UHC are finding it more difficult to financially sustain the health care schemes they have in place. And these are the reasons that make our job more daunting. And meanwhile, the international community are rallying to rescue the Sustainable Development Goals as a central component of multilateral cooperation. And in so doing, it is important to focus on how to make health for all our sustainable future for human security. Thailand certainly underscored the importance of investing in UHC as the foundation of strong and resilient health system. And this preemptive investment is a cost-effective social protection measure. It would ensure that people, especially those most vulnerable who access health services, are not exposed to financial hardship. And from our individual and collective experiences in tackling COVID-19, it is crystal clear that the global health challenges can disrupt decades of development efforts and even, I repeat, even reverse years of development gains. I would also like to emphasize the importance of improving primary health care to address the health needs at the community level by integrating together at least these 3 or 4 elements. Together, care, prevention, promotion, and education. Primary health care improves the performance of health system by lowering overall healthcare expenditure by improving population health and accesses. To achieve universal health coverage, reform should focus on strengthening primary health care to ensure equity and cost containment. And Thailand strongly believes in the empowerment of communities and social participation in primary health care, such as our successful example of the Village Health Volunteers Program. People involved in this program has been a million altogether all over the country. And we also train migrant workers to perform these volunteers talk tests for their peers. And that was how we managed to efficiently contain the spread of COVID in a cost-effective manner. And we would also like to stress the importance of prevention and healthy lifestyle promotion to make UHC sustainable. And this year, Thailand will become an integral home to the ASEAN Center for Public Health Emergencies and Emerging Diseases, or we call in short, ACFED. Thank you, Japan, for that. And it will serve as a center of excellence and regional hub to strengthen ASEAN regional capabilities to prepare, prevent, detect, and respond to emerging health emergencies. We all have fumbled in so many ways in our response to COVID-19. We have learned from these experiences, and we must not allow a repeat. Excellencies, the group of friends of USC, welcome Jamaica, of USC will work with partners to create a platform for thematic discussion in preparation for HLM on USC in 2030. And we reiterate our readiness to support the USC process in every way we can, with all the mechanisms and tools we have. So together we shall do our part in strengthening the World Health System and thereby sustaining the SDGs, Sustainable Development Goals. I thank you very much.
Thank you. Thank you, Excellency. Appreciate that. And we are grateful for Thailand's leadership on commitment to this agenda and all of the innovation that you just mentioned in your opening remarks. May I turn now to Minister Yoshimasa?
Thank you, Elisha. Distinguished guests, dear colleagues and friends, thank you for participating in the ministerial meeting of the group of friends of Universal Health Coverage. And I am very pleased to be able to co-host this meeting in person for the first time. So the spread of the COVID-19 has exposed vulnerabilities in equitable access to healthcare throughout the world. So this reality highlights the importance of strengthening and accelerating efforts to achieve universal health coverage in a spirit of leaving no one's health behind. However, at present, half of the world's population doesn't have access to basic health services, as my friends Minister Don already mentioned, including response to COVID-19. So under such conditions, human security is threatened, and the economic and social development of nations are hampered. So through the COVID-19 crisis, it hit home to the world that investment in health systems is critical to strengthening the foundation of resilient economies and societies. It is necessary to make use of the momentum that we have obtained from COVID-19 to strengthen efforts to achieve the UHC. So with a view to achieving UHC, Japan has led the global COVID-19 response in 3 pillars. First, overcoming the current COVID-19 crisis. And second, strengthening health systems to prevent, prepare for, and respond to future health crises. And third, addressing a wide range of health challenges, including traditional infectious diseases, to build better health security. In the fight against COVID-19, we have provided approximately $5 billion to support efforts in low middle income countries. Particularly, Japan has taken leadership in ensuring equitable access to vaccines, which is key to the containment of COVID-19, including through up to $1.5 billion of financial support for the COVAX facility. In addition, Japan announced a pledge to contribute up to $1.08 billion over the next 3 years to the Global Fund in order to contribute to measures against the 3 major infectious diseases and to strengthen health systems with a view to achieving universal health coverage. Strengthening health system in normal times towards achieving UHC is essential in order to beef up prevention, preparedness, and responses, PPR, as already mentioned, for future health crises. Japan has taken action on this conviction. For instance, in Ghana, Japan has a long-standing financial and technical cooperation with the Noguchi Memorial Institute for Medical Research. In the COVID-19 context, it was able to provide the PCR testing not only in Ghana, but also in 9 neighboring countries, thanks to the human resources and testing systems strengthened by Japan's contributions. In Vietnam, the medical network of the core hospitals established with Japanese cooperation over the years have served as the foundation of the COVID-19 response. And also, as already noted by my friend Don-san, Japan has been fully supporting the ASEAN Center for Public Health Emergencies and Emerging Diseases. This sounds a little bit longer, so that's why we call ACFED for that, towards its full-scale operation, both financially and through technical assistance. So Japan will continue to support the center's activities, including through dispatching our experts to that. Next year, we will host the G7 Hiroshima Summit. Having experienced the COVID-19 pandemic, now is the time to learn from its lessons, build better global health architecture, and once again strengthen global momentum toward achieving universal health coverage. The group of friends of UHC was created by Japan and several other like-minded countries. This group worked to bring about an agreement to achieve universal health coverage by the leaders of all UN members state at the high-level meeting of the United Nations General Assembly on UHC here in New York 3 years ago. It was just before the COVID-19 actually started. A year from now, the leaders of all UN member states will gather their wisdom to discuss UHC and PPR again at the UN General Assembly. Based on the global health strategy formulated in last May, Japan is determined to continue to lead G7 and international efforts, including discussions on how to promote universal health coverage in the post-COVID-19 era. We look forward to working closely with UHC friends. Thank you very much.
Thank you, Excellency. We appreciate so much Japan's leadership on the UHC movement, as well as your continued commitment to the Global Fund and global health security. May I turn now to Minister Azarashvili for some opening remarks.
Excellencies, dear Dr. Tedros, distinguished guests, it's my honor to address you on behalf of the Ministry of Health of Georgia. The government of Georgia launched the Universal Health Coverage Program in 2013. The program allowed to achieving a significant progress in improving access to health services. Currently, the state funding covers about 95% of the population of Georgia, with the remaining share of the population covered by other schemes, such as corporate or individual private insurance. In addition to the UHC program, the state also finances health services for all legal residents under 23 priority public health protection programs. This aims to provide broad geographic coverage and access to disease prevention, immunization, early detection and screening, disease management and risk reduction counseling for the designed health conditions or services. The program includes unlimited financial access to tuberculosis, HIV and hepatitis C services, among others. Since its initiation, the program resulted in substantial reduction of out-of-pocket payments for health and improved clinical outcomes in many directions. Once again, I would like to reaffirm that Government of Georgia remains strongly committed to achieving universal coverage with health services by 2030. Our new health strategy, adopted in May this year, sets ambitious but realistic targets for strengthening health systems and eliminating remaining disparities in access to quality health services, safe and effective drugs and vaccines. Like many other countries globally, in Georgia, COVID-19 has posed critical challenges to a health system. The health sector has been operating in a very complex economic, social and healthcare environment. The COVID pandemic showed us again the importance of primary care and public health services. During the pandemic, we have observed very strong interconnection and synergies between health security and UHC policies and interventions. Dual efforts were undertaken aimed at addressing devastating consequences of pandemic on the one hand and at maintaining uninterrupted access to essential services on the other. Building on experience of pandemic period, the government will continuously invest in strengthening public health laboratories, ambulance and emergency coordination centers, and other healthcare institutions to maintain adequate emergency response capacity. Early this year, the government of Georgia has initiated a set of policy reforms to accelerate progress towards establishing a patient-centered health service model that would be comprehensive and fully aligned with best available evidence on effectiveness and efficiency of health interventions. Strong partnership with the WHO and other UN agencies, World Bank, EU and US-based public health institutions has enabled us to quickly mobilize technical and financial resources for implementing health sector reforms. Ongoing reforms are addressed at strengthening primary care, introducing new hospital payment mechanism and regulating prices of essential drugs for managing non-communicable disease and cancer. Georgia is increasingly investing in information technologies to build a strong e-health platform and use telemedicine for improving quality of care and patient experience. The government of Georgia intends to further improve coverage with the state-funded programs by making the benefits package more comprehensive and responsive to individuals' health and well-being. Georgia remains committed to global movement and would be happy to continuously work with all partners for building a truly equitable and resilient health system nationally and globally. Thank you for the attention.
Thank you, Excellency. Appreciate Georgia's commitment and also your highlighting of partnerships and how important that is for moving the agenda forward. I'm going to turn now to Dr. Tedros for some remarks, and I understand, Dr. Tedros, you have to leave right after these, so thank you for sticking with us and sharing your thoughts. The floor is yours. It's on. It's on.
No light. Thank you. Sorry. Thank you, moderator. And I wish I, of course, could be with you because all roads lead to universal health coverage, and this is the best place to be. But because of other commitments, I will be leaving, and I hope you will understand. Honorable ministers, excellencies, dear colleagues and friends, I thank Thailand, Japan, and Georgia for hosting today's event together with our partners at UHC 2030, IFRC, and the UN Foundation. 3 years ago, we met here in New York for the first high-level meeting on universal health coverage. We knew nothing then of what lay just around the corner. The COVID-19 pandemic has demonstrated in devastating fashion that when health is at risk, everything is at risk. The pandemic is not just a health crisis. It has disrupted businesses, economies, schools, families, societies, and more. Even before the pandemic, almost 1/3 of the world's population lacked access to essential health services, and almost 2 billion people experienced a catastrophic financial hardship in doing so. The pandemic has sent us further back, with over 90% of countries reporting disruptions in essential services. Compounding this are the existential crises of climate change, food insecurity, and prolonged conflict. We live in troubling times. The need for universal health coverage in all countries is more obvious and urgent than ever. Our resolve must be stronger than ever, and our vision must be higher than ever. That's why one of WHO's top priorities for the next 5 years is supporting countries to make a radical reorientation of their health systems towards primary health care at the foundation of universal health coverage. We know that 90% of essential health services can be delivered through primary health care. Investing in primary health care could have over 60 million lives and increase 60 million lives saved and increase global life expectancy by 6.7 years by 2030. But we also know that there remains much work to be done to expand service coverage and financial protection, especially for the most marginalized and hardest to reach groups. After all, it's not universal health coverage if it's not universal. The conundrum many countries face is the urgent need for increased public financing for health at precisely the same time when economies are stagnating, budgets are squeezed, and inflation is rampant. We get it. There are no quick fixes or short-term solutions. Most countries won't reach universal health coverage tomorrow or next year or even by 2030. But unless we all move with intention down that road, we will never get anywhere. This is mission critical for WHO. It's central to what we do and who we are. We are resolutely committed to supporting all countries, inch by inch, village by village, to increase access to services and reduce financial hardship. The WHO's special program on primary health care is now supporting 120 countries with a focus on the least served, most marginalized populations. But we can't do this alone. Through the Global Action Plan for Healthy Lives and Well-being for All, we're working with our multilateral partners to support countries to deliver on their commitments on UHC with a focus on primary health care. A year from now, we will meet here in New York for the high-level meeting on UHC. The world has changed, but our ambition has not. A world in which no child misses out on vaccination, no woman misses out on sexual and reproductive care she needs, no household need decide between food and medicine, no community misses out on care where and when they need it, not health for most, not health for some, health for all. I thank you. And moderator, back to you.
Thank you, Dr. Tedros. We can't say enough about how much we appreciate your leadership on this issue and everything WHO has done during the pandemic and will continue to do to achieve the agenda. I think that you have to leave, and I believe Minister Yoshimasa also has to leave. I would just like to thank the Director General and our co-hosting ministers very much for your commitment and leadership and for gathering us here today. We will turn now to the rest of our ministers at the table for some more sharing of country experiences with UHC.
It's global fund replenishment.
I would like to introduce our next panelists that we're lucky to have with us today to talk about their experience with advancing this agenda. We have Senator, the Honorable Ms. Kamina Johnson-Smith, the Minister of Foreign Affairs and Foreign Trade from Jamaica, the Honorable Mr. Peter Sierto, Minister of Foreign Affairs and Trade of Hungary, and the Honorable Mr. Sanjay Verma, Vice Minister for Foreign Affairs from India. Welcome and thank you for being here. I'm going to start first with you, Minister, if I may, to share your experience in Jamaica with advancing the UHC agenda.
Thank you very much, Madam Moderator, Excellencies. I will start, even in their absence, by thanking the co-chairs, of course, of the Group of Friends of Universal Health Coverage and Global Health for extending an invitation to Jamaica to participate in this timely and very important exchange. In 2019, Jamaica launched its Vision for Health 2030 plan, which embraces the results-based management framework established in the SDGs and enshrined in our National Development Plan. We've therefore taken into account the progressive realization of universal access to health and universal health coverage as a central approach. However, like many other countries, the COVID-19 pandemic exacerbated existing vulnerabilities in Jamaica's healthcare system, including structural weaknesses, and of course, precipitated the health crisis. As we attempt to build back stronger and more resilient, it's clear that discussions on economic growth and development can no longer view healthcare as a cost to the public purse, but instead as an investment in our people for future resilience and prosperity. It's in this vein that the Jamaican government embarked on a decade-long reform of its primary healthcare system to ensure that the changing demands for healthcare services are met, as well as the continuity of these services in the event of a pandemic or natural disaster. With the triple threat of communicable diseases, non-communicable diseases, and climate change, it's never been more important to reform the primary care system in order to support resilience. In keeping with the Vision for Health, Jamaica's Primary Care Reform Plan 2021-2030 puts primary care as the first point of contact and at the core of the health system through integration of primary and secondary care facilities, including public health departments, diagnostic and therapeutic sites, and hospitals. Its provisions also enable collaboration among health teams, as well as between public and private partners. In this way, the health system becomes more responsive to the needs of vulnerable populations, including the chronically ill and disabled persons with mental illness, the elderly, as well as low-income or homeless individuals. Excellencies, like other middle-income countries and small island developing states, Jamaica has made significant efforts to increase spending on health during the pandemic. However, highly indebted developing countries like us have also had to defer investment in pandemic recovery and cut national expenditure in health and other priority areas of socioeconomic development in order to service debt. The fiscal constraints in many developing countries are further eroding progress on the health and poverty-related SDGs, pushing into poverty those who have to pay out of pocket for primary health services, or worse, having them simply not seek care. Closing the gap will require a strong mix of domestic and international investments, a substantial increase in development assistance in health, stronger engagement of the private sector, and innovative health financing policy solutions. The financing needs to support the 2030 Agenda and related framework for development must be adequately addressed within the multilateral system. In this regard, Jamaica reiterates its call for the reform of the international financial architecture to assure appropriate access to concessional financing for highly indebted middle-income countries and SIDS in order for us to meet our needs. In the present global and health emergency, financing instruments such as debt swaps, state contingency debt instruments, and specialized liquidity funds will create the fiscal space to address issues of debt repayment, but also channel well-needed investments into healthcare, climate resilience, social spending on health and education to promote economic growth and development. Urgent action is also needed at the multilateral level to ensure the scaling up of international public finance through concessionary finance, reduction in lending rates, and addressing debt overheads to reduce debt burden. Moreover, financial flows must be aligned to sustainable development, addressing the unique vulnerabilities of SIDS and their national priorities in order for the SDGs to be tangible, meaningful, and attainable. I know for some it is not obvious for us to discuss financing in such detail when discussing health, but the truth is you are unable to deliver the services without financing when your debt takes all of your budget, quite simply. Excellencies, I believe we all understand that without good health and effective and accessible healthcare services, there can be no sustainable development. Healthcare is indeed an investment, and we must pivot our thinking to ensure that our investments have the greatest return to ensure a positive and resilient future for generations to come. For Jamaica, this is non-negotiable and a social and economic imperative. In looking ahead to the high-level meeting on universal health coverage in 2023, we therefore urge fellow member states to continue the call for sustainable global health financing as we re-engage the social contract that involves all citizens in this new paradigm for healthcare. I thank you.
Thank you. Thank you, Excellency, for those insightful remarks and for reminding us that we have to get the finances right if we're going to advance and achieve the UHC agenda. I'd like to turn now to Minister Sierto for your remarks.
Well, first of all, I'd like to express my appreciation to the Deputy Prime Minister of Thailand. Thank you very much, dear Don, to convene us here today, just 2.5 years after the most serious healthcare-related catastrophe of the history of our generation has basically broken out. I'd like to mention here 3 points, if you don't mind. First, that everything starts with clean water. So international efforts should aim at ensuring access to safe water to everybody on this planet. Second, that issues regarding healthcare and saving lives of the people must not be confused with politics. And third, that the differing level of standards of healthcare ensured in certain countries must not serve as a legal basis for illegal migration. So on first issue regarding clean water, you know I'm representing Hungary, a nation of Ignaz Semmelweis, who was considered to be the savior of the mothers, as he discovered the disease-fighting power of washing hands. And with that, he saved lives of hundreds of thousands of mothers and their babies. And interestingly enough, that took place in 1847, and then almost 200 years after, so 170 years after, this issue is more actual than ever. And we have to be aware of the disease-fighting power of hand wash, which must take place with clean water. And that's why Hungary is a committed supporter of the efforts of the United Nations to ensure safe water, sanitation, and hygiene for all people living on this planet. That's why together with the Philippines, we have been co-chairing the group of friends in the United Nations of initiative called WASH, meaning water, sanitation, and hygiene. The Constitution of Hungary says very clearly that all people have the right to health and to healthcare. And in Hungary, there's 100% of access to clean water. And we have made a lot of efforts in developing water, sanitation, and purification technologies to be spread all around the world in the framework of development programs. Second issue, why I mentioned that healthcare and issues of saving lives of people must not be confused with politics. The reason why I mentioned that was that this principle has been broken during the fight against COVID, unfortunately. We do believe that people must not die because of political decisions. That's why it was totally ununderstandable and irresponsible behavior on behalf of some actors of global politics that the type of vaccine to be picked was kind of considered as a political statement, which was not the case, definitely. In case you want to save lives of people, then it should be considered as a core professional issue, just like everything in healthcare. There are general standards which equipments, devices, and medicines used in healthcare must meet, and the question of origin is not among these kind of general conditions and standards. In Hungary, we have used both Eastern and Western vaccines, which put us as number one in Europe at a certain time when it was about the speed of vaccination. And this put us in a position that we could help other countries with donating or selling 7 million doses of COVID vaccines for countries all around the world. And last but not least, the third issue, universal health coverage must not serve as a legal basis for illegal migration. International law is clear about who can stay where for what reason, according to regulations. Whoever has to escape from his or her home is entitled to stay temporarily on the territory of the first safe country. Everything beyond that is illegal. We are fighting with the threat and risk of illegal migration. Only this year we had to stop 180,000 illegal migrants at our borders. But in the meantime, we have received 1.5 million refugees from Ukraine, for whom we are the first safe country. And of course, we ensure them an equal access to both education and healthcare as well. This is because this is the way it has to be. Thank you so much, dear Don. Thank you also to Tedros, of course, because he made a wonderful job during COVID in order to prevent the confusion between the fight against COVID and politics. And I think that was very, very important. Thank you so much.
Thank you, Excellency, for those wonderful remarks and for reminding us that clean water is key to effective and equitable health systems. I'm going to excuse Minister Johnson-Smith, who has to go to another engagement. Thank you so much for being here. And now I'd like to turn to Minister Verma for your remarks.
Well, thank you, Deputy Prime Minister of Thailand. Thank you for this opportunity. In lieu of salutations, allow me to say that all the countries represented on this table are countries with which we have excellent relations, very close relationships, including Dr. Tedros, who was my foreign minister in Ethiopia when I was ambassador there. So it's a happy coincidence. So the concept of a group of friends has a double resonance for us this morning. Let me share the Indian experience, because while we may be one of the fastest growing major economies of the world and we are jumping up the economic ladder, we still hold experiences and a reality which reflects issues and conditions of the global south. We represent 1/6 of humanity in a landmass which is 1/3 of Africa. Our population is more than Africa, so we've had these challenges which we have taken on. We operate in a robustly democratic environment. So ours is a showcase situation which merits some sharing of experience, because it may find validation in different parts of the world. So allow me to say that the Government of India accords utmost priority to universal health coverage. Prime Minister Shri Narendra Modi had participated in the first ever high-level meeting on universal health coverage in September 2019. Under his leadership, India has taken historic steps to ensure affordable health for all. India has taken a holistic approach towards this subject based on 4 main pillars of healthcare. The first is preventive healthcare. We have laid special emphasis on yoga, Ayurveda, and fitness aimed at controlling lifestyle diseases. The second pillar is affordable healthcare. India has launched the National Health Protection Scheme called Ayushman Bharat Scheme in September 2018. The scheme is based on the twin pillars of expanding access to primary healthcare service through health and wellness centers and providing insurance coverage for secondary and tertiary care hospitalization to poor and families in vulnerable situations. This scheme provides for health insurance cover up to US $7,000 per family every year for secondary and tertiary hospitalization. This insurance is provided to make 100 million households or about 500 million people. And the insurance scheme provides cashless and paperless access to health services for every beneficiary at designated hospitals across the country. So the scheme has a digital backbone which is economical, affordable, transparent, and speedy. The third pillar is improvement on the supply side. We have taken several major steps for quality medical education and for medical infrastructure development, including the plan to set up 157 new medical colleges. The fourth pillar is mission mode intervention. We have inter alia started the National Nutrition Policy to improve the nutritional status of the people, especially disadvantaged groups, including mothers, adolescent girls, and children. We run several schemes for poor households and especially children in school. It's called the midday meal, where free lunch, wholesome lunch, hot lunch, freshly prepared, is provided free of cost to millions of school-going children across the country. Excellencies, the COVID-19 pandemic has indeed highlighted systemic weakness in health systems and vulnerabilities in the capacity to prevent and respond to pandemic threats. The pandemic has also re-emphasized the need for continued financing and investment to strengthen health systems to achieve universal health coverage, to strengthen health emergency preparedness and response, and to support health promotion. India believes that equity is of critical importance for global health. We should address the barriers to development and distribution of medical countermeasures, including aspects related to intellectual property, technology transfer, and scaling up of local and regional manufacturing capacities during health emergencies. In line with this thinking, India supplied over 240 million vaccine doses to over 100 countries during COVID-19 pandemic, reinforcing its image as the pharmacy of the world while running the largest vaccination program in the world, domestically administering over 2 billion vaccine doses. Deliberations on global health also remain at the core of India's forthcoming G20 presidency. During the presidency, India will be focusing on sustaining as well as expanding deliberations around global health architecture, which requires not only financing and technical expertise at national, regional, and global levels, but also requires a high level of political commitment. India will also emphasize upon digital health solutions for strengthening and improving healthcare delivery to aid universal health coverage and sustainable development goals, and strengthening cooperation in the pharmaceutical sector. As I conclude, I reiterate a firm commitment to partner with member states and other stakeholders to synergize our efforts to accelerate progress towards achieving sustainable developmental goals and universal health coverage with the most productive, efficient, and effective utilization of resources. Thank you for your attention.
Thank you, Excellency. Thank you so much for your leadership and commitment to this issue and advancing UHC in such a populous and diverse country, as well as that insight into your chairmanship in 2023. At this point, I would like to thank all of our ministers for your time, for your leadership, and for your commitment to this. We look forward to working with all of you to move this agenda forward. And I'm going to ask that we now move to the second segment of today and reset the table and have our other speakers come up to the front. Thank you all so much.
The COVID-19 pandemic has increased how societies value health. We have never been so aware of government actions to protect our health and well-being. Yet, too often, people's insights and lived experiences remained unheard in government decision-making. Governments must make a targeted effort to change this. Amplifying people's voices in health policy making by using participatory spaces as part of decision-making processes is the way forward. If these spaces are well designed and used regularly, They have a transformative potential to become a potent tool for more responsive and implementable policies. There are many ways governments can engage with the population to capture their needs. Mechanisms such as open forums, citizen juries, consultative meetings, and district health committees with fixed seats for civic and community groups are all methods of engagement. But government resources and capacities are too often lacking to manage these spaces effectively. The WHO Handbook on Social Participation for UHC provides practical guidance for policymakers to engage with the population by creating, strengthening, and sustaining participatory spaces. Policymakers must learn how to design spaces to empower people to express themselves frankly. Several examples drawn from countries' experiences are laid out in the handbook on how to do this. For example, define clear criteria to select participants. Be explicit about roles and the added value each participant brings to the policy question. Communicate roles and mandates transparently to all participants. Transparent communication lends legitimacy to each participant and values inputs equally. This is especially crucial for community and civil society groups. More influential stakeholders, such as academia, medical doctors, and government actors, derive legitimacy from their professional positions or standing in society. Therefore, a targeted effort is needed to lend legitimacy to those whose voices are generally less heard. It's time to invest in social participation. It's time to move towards regular and systematic public and civil society engagement for health decision-making. It's time to build a health system that belongs to the people and responds to people's needs, where no one is left behind.
Now to move us into our second segment of today, which is setting the scene with some key remarks from our two panelists here. But first, I'm going to ask us to watch a short video, a message from the Honorable Miss Amina Mohammed, Deputy Secretary General of the United Nations. Can we have that video, please?
Excellencies, ladies and gentlemen, I'm pleased to join you virtually today for the third annual ministerial event on universal health coverage. I would like to thank the co-chairs of the group of friends of UHC, Georgia, Japan and Thailand, as well as the other co-sponsors of today's event, WHO, IFRC, UHC 2030 and the UN Foundation, for keeping universal health coverage high on our agenda. Health is the cornerstone of sustainable and equitable development. It deserves our full attention and action. We are exactly 1 year away from the 2023 UN high-level meeting. The meeting will be an opportunity to measure global progress on implementing the 2019 political declaration and its commitments to expand access to quality, affordable, essential health services. COVID-19 has dramatically interrupted and reverse progress, teaching us hard lessons about the consequences of neglecting and underinvesting in health systems. In fact, 92% of countries reported some extent of disruptions in at least one essential service due to COVID-19. At the same time, many health-related SDG targets are now further off course, from maternal mortality to communicable and non-communicable diseases to childhood immunization. Next year's high-level meeting will also be an opportunity to go beyond the status quo and strengthen health systems for the future. This is critical for building resilience to global shocks and ensuring we are prepared for current and future pandemics. We must never be caught so unprepared again. Throughout all of this work, we are reminded that stronger policies and investments in primary health care are critical to recovery around the world and to achieving universal health coverage. 90% of essential health services can be delivered through primary health care. investing in primary health care could increase global life expectancy by as much as 6.7 years by 2030. It represents a practical solution to the health challenges that weigh down progress and human and economic for all people. It's an investment that must be made. Throughout, we must work as one. Now is the time to unite national action with multilateral collaboration. Let's continue working together and ensure that the promises we make are translated into strengthened governance, investment and accountability that we need. Thank you.
Those remarks. She has been such a tremendous champion on this issue. Now I'd like to ask Mr. Yagan Chapagan, who is the Secretary General of the International Federation of the Red Cross and the Red Crescent, and also celebrating a birthday today, to offer some remarks about reaching vulnerable communities. Mr. Chapagan, please. You don't need to press the button. It's on autopilot.
Thank you so much, and for also releasing that secret. I was trying to. Clearly doesn't work. Excellencies, colleagues and friends, so good to be here. And my deep appreciation to Thai mission here, Thai government for being such a kind host, such a generous host. I had a chance to visit Thailand a couple of weeks ago, and we had exactly the same hospitality. So my sincere appreciation. And of course, great to be also with the panelists here. Really my honor. Thank you so much. It's an honor to co-host today's event. It's part of the group of friends on universal health coverage and speak on behalf of the International Federation of Red Cross and Red Crescent Societies. As you know, we are comprised of 192 national societies and with about 15 million volunteers across the globe. And we are very proud of that number. Universal health coverage, which embodies the right of all people to quality, accessible, affordable, and available health services, reverberates deeply with the IFRC's core mission to act in the interest of the most vulnerable and alleviate human suffering. Since 2018, we have been scaling up our work on UHC and aligning ourselves with the WHO's program of work. As a member of UHC 2030, we supported country focus groups before and after the 2019 high-level meeting to share live experiences, challenges, and achievements in UHC from populations often left behind. This year, the IFRC conducted country consultations across the globe with communities and civil society groups to identify barriers to accessing basic health services and to provide key inputs to the State of UHC Commitment Report. Despite all the progress, we are witnessing that many vulnerable groups and marginalized populations lack access to life-saving health services. And I have witnessed that personally at the heart of Europe myself, and how the Red Cross, local Red Cross units have been reaching some of these marginalized groups. 1 year from today, the high-level meeting on UHC must serve as a juncture for making the political commitments to strengthen health systems for future generations. And I would like to share a couple of thoughts. The first, we must prioritize the health needs of the most vulnerable, especially in situations of disasters, climate crisis, health emergencies, and violence. Governments must tackle stigma and discrimination and build trust by integrating vulnerable communities into policymaking itself. Women and girls have reported greater difficulties in accessing healthcare, and people on the move are often completely left out of national health schemes. And the point I was referring to, I saw mostly the migrants at the heart of Europe, and actually in some of the very generous countries, actually having to hide to access basic health services in the facilities run by Red Cross and I'm sure many other organizations. And a lot of times this access is impeded because of the labeling of these people as legal or illegal. And in Red Cross, we don't consider any human being illegal. No human being is illegal. I think they have a situation they are in. Of course, people are in different situations. But we cannot consider any human being as an illegal human being. Human being is a human being. And I think it's extremely important that when we are designing UHC and we want to roll this out, we need that very clear distinctions, that every human being, wherever they are, must have that access to the health services. Secondly, we must invest on ensuring safety and protection of community health workers and volunteers, including, of course, our own Red Cross education volunteers, who have a deep understanding of the risk, vulnerabilities, and inequalities that affect the health status of their communities and represent a key resource by working with the formal health system to deliver services. And as we saw during the COVID-19, when the formal health systems got so overburdened, and including in developed countries, it was actually these volunteers, like the Red Cross volunteers, the NGO volunteers, they actually came forward. And in Red Cross, we were very humbled to see that statistic that on an average, we have 1 million volunteers volunteering every day during the COVID-19. And our first volunteer, who unfortunately died because of COVID-19, was on 18th of February 2020 in Italy, at the heart of Europe. And these are some of the sombering statistics and information we need to keep in mind and ensure on their safety and duty of care to these volunteers. The role of community first responders in ensuring improved and timely coverage of essential health services became even more obvious during the COVID-19 pandemic, as I was just mentioning. Thirdly, the government should develop community health strategies to improve collaboration between public health services, communities, and civil society organizations. More investment is needed in scaling up risk communication and community engagement. It's a key component of people-centered health systems. And I'm so pleased that I'm sitting next to Omar, where we have been doing some great work together with some of the other organizations. We strongly believe in empowering communities and ensuring their meaningful engagement in decision-making. Our national societies, as neutral and impartial actors, can translate the needs of the communities into policy, social protection systems, infrastructures, laws, and governance issues. Health systems should also be backed by better public health emergency laws that enable systematic responses to pandemics and health emergencies. We have just launched a guidance on public health emergency law to support this. Lastly and importantly, there is no health without mental health, especially in crisis situation and as we have seen this post-COVID-19. I don't know whether I should use the word post or not yet, but we are in a situation where we are. Health system strengthening means integrating and resourcing mental health and psychosocial support services for all who may need them. Excellencies, colleagues, access to health service is not a privilege and should not be treated as such. We cannot afford to lose the opportunity of next year's high-level meeting and cannot waver. Achieving universal health coverage is the only way forward. We are committed to continuing work with governments and other partners to implement our shared commitments to UHC and stronger health systems for everyone, everywhere. Thank you.
Thank you so much. Thank you, Mr. Chapagan. And thank you for that last line, that access to health is not a privilege, and we should not treat it as such. Very, very insightful. I'd like to ask Mr. Omar Abdi, who is the Deputy Executive Director of UNICEF, to offer some remarks. It's on.
Thank you, Elijah. It's easier for me to speak after my friend Chagan. I could just say that I agree with everything he said and concluded. But thank you. Thank you, colleagues, and good morning. It's great to be with you. And huge appreciation to the group of friends of universal health coverage for their continuous advocacy and for keeping UHC at the top of the political agenda. The right to health for every child is enshrined in the Convention on the Rights of the Child, the most rapidly and widely ratified human rights treaty in history. That's why child survival and development has been the core of UNICEF's work since its founding in 1946. And also as a signatory to the SDG 3 Global Action Plan, UNICEF is committed to work with other multilateral partners to provide coherent support to country-led strategies for achieving universal health coverage. In fact, UNICEF is pleased to co-lead with WHO the primary health care pillar of the Global Action Plan. As Dr. Tedros mentioned earlier, 90% of essential health services can be delivered through primary health care. And there is ample evidence that increased investment in primary health care can improve population health, reduce child and maternal mortality, and reduce overall health costs. But to reach the most marginalized, the children that don't receive even one dose of a vaccine, strong community-based primary health care system is needed. Community-based health system is the equity arm of the primary health care care and provides a cost-effective platform to reach the last mile. In fact, studies have shown that investing in community health as part of primary health care is a smart investment that yields a 10-to-1 return on investment. So recognizing its value, countries are increasingly integrating community health within the primary healthcare system. But progress is slow and opportunities are being missed. Governments need to allocate robust and sustainable funding for adequate numbers of community health workers that are skilled, supported, equipped, and fairly compensated to expand preventive and curative services at community level. In an environment of tight budgets and competing demands for resources, the only way we can achieve universal health coverage by 2030 is by expanding and investing heavily in community health as part of primary health care. Thank you, Alish.
Thank you. Thank you, Mr. Abdi. I think we all agree that health workers are key to achieving universal health coverage, and it was refreshing to hear you say that they should be compensated. That's very important. Thank you so much. I'd like to thank both of our speakers at first and bring in now the rest of the panelists at the table for some more discussion on how we get to UHC. We heard a lot this morning on political will and commitment, which is wonderful, but how do we actually do it? So with us today is Dr. Mandeep Dhaliwal, Director of the Health Group at UNDP, Ms. Anna Maria Behar, Director of Public Policy Engagement with Gavi, and Ms. Amy Boldesser-Bosch, Civil Society Engagement Mechanism for UHC 2030, as well as the Senior Technical Director at Management Sciences for Health. Dr. Dhaliwal, I'm going to start with you and ask if you could tell us a little bit how UNDP has worked at the country level to promote implementation of the political declaration on UHC.
Thanks very much. And I want to start just by making a point of context, which has been explicit, I think, in what we've been talking about since this morning. Sorry, this mic is a little menacing because it's, yeah, thank you. Is that COVID has set us back. We heard about life expectancy dropping, certainly in the UNDP Human Development Index. 2 years in a row, we've seen life expectancy drop because of COVID. COVID has reversed progress on UHC in 92% of countries. So our challenge is that much greater. What does that mean? That means we have to act differently. We have to develop new partnerships. We have to find new ways of working. One of the innovative partnerships that we're really proud to be part of is the SDG 3 Global Action Plan, which many colleagues have referenced already today. And it's important because it brings together all the multilaterals working on health to work in a coordinated way to deliver results in a more accelerated manner for people in communities and in countries. And I think that's a really important partnership that needs to go deeper, and that's something I think certainly many of us who are involved, UNICEF, Gavi, the Global Fund, WHO, and others, are really committed to doing. So I think new partnerships are critical. I also think that work on the ground, we need to think differently about what we're doing. And at UNDP, our work on using digital solutions to accelerate and scale, particularly in the health sector through our partnerships with the Global Fund and our partnerships with countries is really critical. We supported 186 countries to scale digital solutions during the COVID pandemic, including in India, where they had one of the fastest vaccination drives for COVID, vaccinating over 1 billion people in a very rapid time in Bhutan. Similarly, so I think the use of digital solutions is something that can help get us back on track for universal health coverage. Secondly, I think the smarter use of data. We live in a world where we are increasingly challenged by the accelerating climate crisis. So we know that the climate crisis is going to affect about 50% of infectious diseases. We know that health systems are going to be burdened excessively and really at greater risk because of the climate crisis. So we really need to build climate-resilient health systems. And how do we do that? One of the critical ways is using climate data for health policy and planning. So I think to address some of the critical blocks or building blocks of UHC, we need to do a much better job of bringing climate and health responses together. And central to all of that is the role of communities. And we really see at UNDP that UHC and pandemic prevention, preparedness, and response are two sides of the same coin. And building climate resilient systems is going to be critical to that, as is the role of communities. And I hope that we're not going to make the mistakes of the past and have very technocratic conversations about pandemic prevention and pandemic response without really looking at how do we resource and support communities who are at the front and sharp point of the spear when it comes to outbreaks and pandemics. So I'm really pleased that we talk a lot more about community health workers as part of the health workforce, but they also must be supported, enabled, and remunerated to do that work. And the final point was about financing. I think it's absolutely critical. Sustainable financing is an important part of the work that UNDP does. Through the SDG 3 GAP and our other work on sustainable financing, we're looking at innovative financing for health, because what we heard from the minister from Jamaica is not an unusual or a unique circumstance. With the shrinking fiscal space and the burden that COVID has placed and the climate crisis is placing on countries, we're going to have to do a lot more in our efforts for UHC to address the financing question. So I'll stop there for now. Thanks.
Thank you so much, Doctor. I think you raised many important points there, and I'm happy to hear the financing piece as well as the reiteration of the link between climate change and UHC, which I think is sort of a growing topic, but we need to get there a little faster. Thank you for that. I'm going to turn now to Ms. Behar from Gavi, and I'm going to ask you, can you talk a little bit about equitable access to vaccines and how that promotes both the UHC agenda as well as global health security?
Thank you so much, Alicia, and thank you so much for the invitation to the group of friends of UHC and Health, and for the warm hospitality of the Thailand mission here in New York. Yes, I mean, it is really at the center of primary health care, bringing immunization to everybody, and especially to children. Gavi's mission is to have the number of zero-dose children by 2030. And zero-dose children are children with no vaccination in the whole life. Unfortunately, COVID has hit hard on this population, and the number of these kids have grown in 5 million since 2019. So now we're looking at 18.2 million children with no vaccination in their life whatsoever. So when we talk about equitable access, we need to really talk about reaching these populations. And these children live in communities. They are usually part of the most neglected groups. They don't have access to water and sanitation, to nutrition, etc. No? So apart from the tragic reality, reaching zero-dose children brings an opportunity for government, civil society, and the multilateral system to really bring together the efforts of reaching the left behind. Sometimes we talk in theory, about people-centered approaches, but we need to see the faces of the people we serve, and these children are a very important part of that. The figures are really striking. So we estimate that 23% of those children are located in fragile and conflict-affected settings. And also the 50% of child mortality occur in those children. So it's really crucially important to also to contribute to primary health and UHC to the response to pandemics is to really bring immunization and primary health care at the center. One very important aspect is the need for all of us to working together as well. Gabi is also signatory of the SDG 3 Global Action Plan for Health and Wellbeing. Very proudly, we contribute to that group. But I think it's important to think about also the diversity of the SDGs and the fact that we are all a social sector. So when we talk about immunization, we're talking about primary health care, we're talking about populations and people, and we're talking about nutrition, wash, access to justice, access to rights for migrants, very much supporting what Jagan said about no human being is illegal, and part of those communities are also these children who are neglected. So how do we work together as a social sector, if you like, and not only as a health sector, because universal health coverage occurs in a context. Finally, the opportunities now to contribute and to be prepared and respond to the next pandemic are enormous. But we are departing from a really difficult situation in which we have promised so many things to people in need and that are not being fulfilled. And I have to say, we are really nervous about what's going to happen next year in the SDGs reviews. So we need to put at the center of any system of PPR accountability and global solidarity, where equity is really at the center of everything we do.
Thank you so much. And thank you, I think, for reminding us that we're talking about equitable access to all kinds of vaccines, not just COVID vaccines, and how important that is for advancing UHC and global health security. Amy, I'm going to turn to you now and ask you, as a representative of UHC 2030, which is a multi-stakeholder partnership, about recommendations you have for moving this agenda forward.
Thanks, Elisha. Thanks to the co-host, to the group of friends, to my esteemed panelists, and thanks to all of you for being here to be a part of this conversation about the importance of achieving universal health coverage and striving towards primary health care. As you heard in the video, at least I hope you could hear it, because there was a lot of ministerial movement going on. The video talked about the WHO Social Participation Handbook. And what the handbook tells us is that the engagement, and what research tells us, and what our lived experience tells us, is that the engagement of communities and civil society in governance of health systems is essential for ensuring that policies respond to community needs and that health systems are accountable to the people that they serve. I think it's an important message. I don't want it to get lost. And although it doesn't always get as much attention as the other commitments in the political declaration from 2019, member states in that declaration actually committed to, acknowledged the importance of active social participation and participatory governance. Governments, member states, of which many of you are representatives, committed to establish participatory and transparent multi-stakeholder platforms and partnerships so that people who are users of health systems could help in shaping UHC packages and monitoring and implementing that work. But the State of UHC Commitment Report last year showed us that in many countries there is little to no opportunity for non-state actors to be formally engaged in universal health coverage, in development of planning, budgeting, or implementation of UHC. While there has been some progress on this, and I want to acknowledge our host, the government of Thailand today, for being a champion of social participation, in other countries, the space for community and civil society engagement is shrinking in very worrying ways. I really think the urgency of this was highlighted in the context of the COVID-19 pandemic. You've heard a lot from my esteemed colleagues about the impact of that on communities. I represent the civil society engagement mechanism of UHC 2030. We are the 1,000 plus member civil society constituency of this global multi-stakeholder platform, UHC 2030. Throughout the pandemic, we heard over and over from our members around the world that there was little to no formal involvement of civil society in the design and implementation of COVID national action plans either. Despite this, civil society, oftentimes volunteers, as we've heard, mobilized to protect the most vulnerable populations who continued to bear a disproportionate burden. How much more effective could our response have been if communities were engaged, if civil society was integrated into the decision-making structures from the beginning? Our pandemic experience has shown us that strong and effective health systems are the ones that are trusted by their end users and responsive to the needs of their populations. Director General Tedros, who was with us earlier, calls trust the most valuable commodity in health. I think that's fantastically important. And the only way to achieve that is to have civil society and communities at the table, to design primary healthcare systems which are responsive to their needs and engage people as equal partners in promoting and maintaining their health as a cornerstone of UHC. Social participation cannot and should not be an afterthought. So we call on the leaders to renew, on member states, on leaders of government, on all of the stakeholders who are part of achieving UHC to recommit to that social participation and inclusion of communities in both the declarations of the high-level meeting on UHC and the high-level meeting on pandemic prevention, preparedness, and response. We also call for collaboration at the global level, leveraging partnership models like UHC 2030 that bring together many of us at this table, many of you in the audience, governments, civil society, donor, UN agencies, and private sector. UHC is a multi-stakeholder issue and requires multi-stakeholder action. I'll close by saying you heard Chagan talking about the country consultations that we conducted in over 40 countries as a part of the State of UHC Commitment Report. That's an important accountability mechanism that was put in place to track progress on the commitments made here in New York in 2019. As I like to say, what happened at UNGA in New York shouldn't stay in New York, right? We need to see those commitments taken back and implemented at the country level. In one of those country consultations, a civil society representative in Singapore said, and I quote, "Often the government has already decided what it's going to do, and they are just going through this process to pretend to listen to communities." Let us not accept that as the status quo anymore. We call on leaders to create participatory spaces that deliberately and meaningfully engage all people, the people you've heard my colleagues talking about here today, and to ensure that that participation translates into UHC policy and practice. Thank you all for your support and for having me here today. Thanks, Elisha.
Thank you so much. You did a great segue into, I think, the closing question for this group, which is what are your hopes for the outcome of the 2023 high-level meeting? And I think community engagement, civil society participation, and partnerships that include non-state actors from the beginning would be coming from you. I'm going to ask Dr. Dhaliwal, what is your hope? And if you can say briefly.
Okay. Well, I think I have a couple. So one is that we really do think about doing things differently and the new partnerships that are needed. And, you know, the SDG 3 Global Action Plan is wonderful, you know, but I'll give an example of another partnership which I think is critical, and it's an issue that we haven't talked about here today. And that is about innovation, access, and delivery of health commodities, be it diagnostics, medicines, or vaccines. You know, we've learned a lot of lessons from COVID. We continue to learn lessons from it in relation to the gross inequity in the distribution of vaccines for COVID. So I think that we need some new partnerships to really be thinking about innovation, access, and delivery together as being critical to driving UHC and achieving the vision of health for all that Dr. Tedros so passionately talked about. The third wish I have is that as we try and regain the lost ground on UHC, that we plan intentionally for the crises that we see and the crises that we don't see. So for example, AMR, vital. Climate crises, which are happening faster and, more profoundly and affecting us. So I would really like us to, for that to be part of the, what we talk about in 2023. And a final just word of thanks to all the partners for having us here today. I think it's been a really thoughtful discussion, and I agree with pretty much everything I've heard. I think the challenge for us now is what are we going to do differently and do more together to drive progress on UHC. Thank you very much.
Thank you so much. Anna Maria, I'm going to turn to you. I'm going to ask you for one wish.
Action together, I would say. And now. Okay. I know everybody's saying the same, the time is now is a very common, but we don't have time. This is urgent.
Wonderful. Thank you. Mr. Abdi?
I would raise a point that Jagan mentioned earlier on. We've learned many lessons from COVID, but if mental health could become an integral part of UHC, I think that is the next epidemic, frankly, if we are not already in it. Yeah.
Yeah. And Mr. Chavadani, you have the last word.
He took what I wanted to say. No, I think probably the number of you said this, but using the different words. The one fundamental to achieve the UHC is a true inclusion. Mm-hmm. True inclusion on everything we do. And I think that will be a real inclusion in true sense, just not on the words would be very important. And a lot of the challenges we are facing now is we are not developing inclusive approach. So that would be my last point.
Thank you so much. Thank you to all of our panelists. Everyone is on the same page, which is wonderful to hear. Inclusive action together now. And intentional. That seems to be the message of the day. With that, I would like to thank you all again and to share a video from the Honorable Mr. Kasaba Korosi, who is the president of the 77th session of the UN General Assembly. Could we play the video, please?
Excellencies, dear friends of universal healthcare. Health, as we are so proud to say, is not a luxury, but a human right. Yet at least half of the people around the world are not able to get the health services they need. And even many who can access doctors and medicine do so at a very high cost. About 100 million people are pushed into even deeper poverty each year because of out-of-pocket spending on health. The COVID-19 pandemic drew our attention to the appalling inequality between the poor and the rich, the developing and developed world, in enjoying basic health services. We have known about this divide, yet failed to understand the real magnitude of the problem. But as Nobel laureate Hungarian scientist Albert Szent-Györgyi has pointed out, the real task is to see what everybody else has seen and to think what nobody else has thought. From now on, we must think differently. For those in need, we must ensure access to the health services whenever and wherever necessary, and without financial hardship. Sufficient funds must be invested in our health system. Increasing government allocations are needed to financing the primary health coverage, which should be more equitable and efficient. In this process, we must prioritize the need of the most vulnerable, including women and children. In 2023, we have to take stock of our achievements and make definite new commitments to accelerate progress in this field. My goal is to ensure synergy between the high-level meetings on health planned for 2023 and the forthcoming SDG Summit. A holistic view on health is essential for the success of the Agenda 2030. I will also strive to align these discussions with the message of the landmark political declaration that was adopted by consensus in 2019. I plan to appoint co-facilitators for the political declaration on universal health coverage in October so that we can start with the process right away. I call on member states to engage constructively in the process and to show commitment through actions. I welcome the initiative by the group of Friends of the Universal Health Care to informally support the high-level meeting process as a platform for discussion. I was pleased to learn that in cooperation with the WHO, the group will organize thematic discussions leading up to the high-level meeting. Dear friends, let's go ahead with our many tasks. Because Thomas Carlyle was right when he said, "He who has health has hope, and he who has hope has everything." Thank you.
Powerful remarks from the PGA. I'm going to ask now for some closing remarks from our co-hosts. If I could first ask the Honorable Mr. Ishikane Kimihiro, the permanent representatives from Japan, to say a few words, and then be followed by the Honorable Dr. Soria Chindawangse, of permanent representative of Thailand.
Well, thank you very much. And first of all, I'd like to thank you for joining us today, out of a very, very busy schedule. I think we had a very rich discussion which, lay foundation or robust, basis for the successful holding of next year's high-level meeting. But it's not for the sake of the meeting itself. It's a robust, basis, should be a robust basis for the further or stronger political commitment, on the robust basis for the action on the ground, engaging various stakeholders, including civil society and the communities. Because at the end of the day, either or not we can deliver basic service to the people in need is a real cause of trust. Trust to the government, trust among people. So for that to happen, I think our cooperation is very much needed. And it is all the more needed at a time when many countries are suffering from the economic downturn due to the geopolitical problems. So let's work together and see you soon. Thank you.
Dear friends, panelists, distinguished guests, simply a few words as the host venue of this very important event. We're very honored to have you present here, and my distinguished co-chair has already mentioned all the important points, as have the various speakers and panelists this morning. Let me just end with this short saying which we thought of that will help all of us sort of remember how important the good health is, and it's very simply UHC for you and me. So let's take it forward together and have a wonderful day. Thank you very much.
Thank you so much.